Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
Which of the following interventions should the nurse anticipate in a client who has been diagnosed with acute respiratory distress syndrome? 1. Tracheostomy. 2. Use of a nasal cannula. 3. Mechanical ventilation. 4. Insertion of a chest tube. The correct answer is 3. Endotracheal intubation and mechanical ventilation are required in ARDS to maintain adequate respiratory support. Endotracheal intubation, not a tracheostomy, is usually the initial method of maintaining an airway. The client requires mechanical ventilation. Nasal oxygen will not provide adequate oxygenation. Chest tubes are used to remove air or fluid from intrapleural spaces. The nurse has placed the intubated client with acute respiratory distress syndrome in prone position for 30 minutes. Which of the following would require the nurse to discontinue prone positioning and return the client to the supine position? Select all that apply. 1. The family is coming in to visit. 2. The client has increased secretions requiring frequent suctioning. 3. The SpO2 and PO2 have decreased. 4. The client is tachycardic with drop in blood pressure. 5. The face has increased skin breakdown and edema. The correct answers are 3, 4, and 5. The prone position is used to improve oxygenation, ventilation, and perfusion. The importance of placing clients with ARDS in prone positioning should be explained to the family. The positioning allows for mobilization of secretions, and the nurse can provide suctioning. Clinical judgment must be used to determine the length of time in the prone position. If the client's hemodynamic status, oxygenation, or skin is compromised, the client should be returned to the supine position for evaluation. Facial edema is expected with the prone position, but the skin breakdown is a concern. A nurse received the taped change of shift report for assigned clients and prioritizes client rounds. In what order should the nurse assess these clients? 1. A client with an endotracheal tube transferred out of the intensive care unit that day. 2. A client with type 2 diabetes who had a cerebrovascular accident 4 days ago. 3. A client with cellulitis of the left lower extremity with a fever of 100.8 degrees Fahrenheit, 38.2 degrees Celsius. 4. A client receiving D5WIV at 125 milliliters per hour with 75 milliliters remaining. The correct order is 1, 3, 4, and 2. Because two major complications of endotracheal tube intubation, inadvertent extubation and aspiration, can be catastrophic events, assessment of this client is the first priority. Cellulitis is a serious infection as there is inflammation of subcutaneous tissues. Third spacing of fluid may promote the formation of a fluid volume deficit, which can be exacerbated by the fever due to insensible fluid loss. The nurse should assess this client next to determine current vital signs and fluid status. The nurse should assess the client with the IV fluids next because the new bag of fluids will need to be hung in 30 to 40 minutes. IV therapy necessitates that the client be assessed for signs and symptoms of adequate hydration, and the IV access site needs to be assessed. From the information provided, there is no indication that the client who had the cerebrovascular accident is unstable. Thus, this client is the last priority for assessment. The parents of a child with a tracheoesophageal fistula express feelings of guilt about their baby's anomaly. Which of the following approaches by the nurse would best support the parents? 1. Helping the parents accept their feelings as a normal reaction. 2. Explaining that the parents did nothing to cause the newborn's defect. 3. Encouraging the parents to concentrate on planning their baby's care. 4. Urging the parents to visit their newborn as often as possible. The correct answer is 1. The parents of children born with defects often have feelings of guilt and ask what they might have done to cause a condition or how they might have avoided it. It is important to allow parents to express their feelings and to accept these feelings as normal reactions. Explaining that the parents are not at fault would not be appropriate until they have dealt with their feelings of guilt. Encouraging long-term planning generally is of little benefit to parents who are emotionally distraught. Additionally, the parents may interpret this as ignoring their feelings and confirming that they played a role in causing their child's anomaly. Urging the parents to visit their infant as often as possible would generally be of little help and could appear to the parents as though they are being talked out of their feelings. The father of a neonate scheduled for gastrointestinal surgery asked the nurse how newborns respond to painful stimuli. Which of the following should be the nurse's best response? 1. Newborns cry and cannot be distracted to stop crying. 2. When faced with pain, newborns try to roll away from it. 3. Newborns typically move their whole body in response to pain. 4. Pain causes a newborn to withdraw the affected part. The correct answer is 3. The neonate responds to pain with total body movement and brief, loud crying that ceases with distraction. After the age of 6 months, an infant reacts to pain with intense physical resistance and tries to escape by rolling away. A toddler reacts to pain by withdrawing the affected part. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is managing care of a prima gravida at full term who is in active labor. What should be included in developing the plan of care for this client? 1. Oxygen saturation monitoring every half hour. 2. Supine positioning on back, if it is comfortable. 3. Anesthesia/pain level assessment every 30 minutes. 4. Vaginal bleeding, rupture of membrane assessment every shift. The correct answer is 3. The nurse should monitor anesthesia/pain levels every 30 minutes during active labor to ascertain that this client is comfortable during the labor process, and particularly during active labor when pain often accelerates for the client. When in active labor, oxygen saturation is not monitored unless there is a specific need, such as heart disease. The client should not be on her back, but wedged to the right or left side to take the pressure off the vena cava. When lying on the back, the fetus compresses the major blood vessels. Vaginal bleeding in active labor should be monitored every 30 minutes to 1 hour. A 24-year-old prima gravida client who gives birth to a viable term neonate is prescribed to receive oxytocin intravenously after delivery of the placenta. Which of the following signs would indicate to the nurse that the placenta is about to be delivered? 1. The cord lengthens outside the vagina. 2. There is decreased vaginal bleeding. 3. The uterus cannot be palpated. 4. Uterus changes to discoid shape. The correct answer is 1. The most reliable sign that the placenta has detached from the uterine wall is lengthening of the cord outside the vagina. Other signs include a sudden gush of vaginal blood. Usually, when placenta detachment occurs, the uterus becomes more firm and changes in shape from discoid to globular. This process takes about 5 minutes. If the placenta does not separate, manual removal may be necessary to prevent postpartum hemorrhage. Which of the following would be the priority when caring for a prima gravida client whose cervix is dilated at 8 centimeters when the fetus is at 1+ station and the client has had no analgesia or anesthesia? 1. Giving frequent sips of water. 2. Applying extra blankets for warmth. 3. Providing frequent perineal cleansing. 4. Offering encouragement and support. The correct answer is 4. The client is in the transition phase of the first stage of labor. During this phase, the client needs encouragement and support because this is a difficult and painful time when contractions are especially strong. Usually, the client finds it difficult to maintain self-control. Everything else seems secondary to her as she progresses into the second stage of labor. Although ice chips may be given, typically the client does not desire sips of water. Labor is hard work. Generally, the client is perspiring and does not desire additional warmth. Frequent perineal cleansing is not necessary unless there is excessive amniotic fluid leaking. The primary healthcare provider prescribes scalp stimulation of the fetal head for a prima gravida client in active labor. When explaining to the client about this procedure, which of the following would the nurse include as a purpose? 1. Assessment of the fetal hematocrit level. 2. increase in the strength of the contractions. 3. Increase in the fetal heart rate and variability. 4. Assessment of fetal position. The correct answer is 3. Fetal scalp stimulation is commonly prescribed when there is decreased fetal heart rate variability. Pressure is applied with the fingers to the fetal scalp through the dilated cervix. This should cause a tactile response in the fetus and increase the fetal heart rate and variability. However, if the fetus is in distress and becoming acidotic, fetal heart rate acceleration will not occur. The fetal hematocrit level can be measured by fetal blood sampling. Scalp stimulation does not increase the strength of the contractions. However, it can increase fetal heart rate and variability. Fetal position is assessed by identifying skull landmarks during a vaginal examination. The son of an elderly client who has cognitive impairments approaches a nurse and says, "I'm so upset." The primary healthcare provider says, "I have 4 days to decide on where my dad is going to live." The nurse responds to the son's concerns, gives him a list of types of living arrangements, and discusses the needs, abilities, and limitations of the client. The nurse should intervene further if the son makes which comment. 1. "Boy, I have a lot to think about before I see the social worker tomorrow." 2. "I think I can handle most of Dad's needs with the help of some home health care." 3. "I'm so afraid of making the wrong decision, but I can move him later if I need to. For I want the social worker to make this decision so Dad won't blame me." The correct answer is 4. Expecting the social worker to make the decision indicates that the son is avoiding participating in decisions about his father. The other responses convey that the son understands the importance of a careful decision, the availability of resources, and the ability to make new plans if needed. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.